NPT reports. Aging matters.
Dementia is incredibly different than all other chronic health conditions because there's all these different forms of dementia. Each one progresses differently, and each individual experiences different dementias in different ways. And you can have more than one.
The underlying cause of all types of dementia is damage to brain cells. This damage interferes with the ability of brain cells to communicate with each other. When brain cells cannot communicate normally, a person's thinking, behavior, and feelings can be affected. The symptoms of each type of dementia are directly related to damage happening in specific brain areas. The temporal lobe controls memory and language. The hippocampus, seated within the temporal lobe, helps a person form new memories and recall old ones. It is one of the first areas affected by Alzheimer's disease, which is why memory loss is often one of the earliest symptoms. When language areas in the temporal lobe are affected by disease, a person might have difficulty understanding conversations, or will talk but not make any sense. The frontal lobe controls executive functions, such as thinking, planning, and organizing. It also controls emotions and behaviors. People with frontal lobe damage can have difficulty making decisions, keeping track of plans, or trouble doing more than one thing at a time. Some people with frontal lobe damage undergo dramatic changes in their personality. Often they will become socially inappropriate, making rude comments, or they can become impulsive and make poor decisions that are out of character, while others lose the ability to control their emotions and may become easily angry. As the dementia progresses, more areas of the brain are affected and symptoms increase. In the later stages of disease, the brain damage causes physical complications, such as trouble swallowing food or problems with being able to walk. When people start having these problems, they are at increased risk for falls, pneumonia, and malnutrition, which eventually cause death.